So I want to say a little bit about my own philosophy or my personal approach to cosmetic surgery. Really throughout my entire career, my goal has been to make things as good as we can for the patient. Procedures that are less painful, that have a quicker recovery, less bruising, smaller incisions, less scarring. All of that is possible, and it's been an evolutionary process over quite a few years. And I'm always thinking about the patient. How can we make it better for the patient? So is it possible, for example, to do a facelift with a shorter incision? So we have our express lift, which is a minimal incision procedure with an incision only half the length of a traditional facelift, and with the advantages of much quicker recovery. That's why we use the term express lift. And one other very important point, a lot of people, they hear minimal incision facelift and they think, gee, is this a real facelift? And the good news is that it is a real facelift. It's the real deal. So everything I'm talking about is designed to get great results. So we're not compromising on the actual procedure, and we're doing a full facelift, even though we're able to use a much shorter skin incision. And the reason for that with the facelift really has to do with the direction of the lift. We're going more in an upward direction, which looks much more natural. Gravity is the problem. Gravity goes straight down. So we can't correct that problem by pulling in a backward direction, because it can look too overdone, too stretched, too much like a wind tunnel kind of look. It's much more natural to have more of an upward angle. And we can't combine that with a much shorter skin incision. So that's just one example. Breast reduction, we can do that with removing the fat. The main problem when breasts are large is that there's too much fat, and just doing a type of liposuction will allow us to significantly reduce the breast without the scarring that you get from a traditional surgical breast reduction. Liposuction, the right type of liposuction with or without extra tightening measures can actually replace the need for a tummy tuck or abdominoplasty. Again, the big advantage to the patient is really minimal or no scarring at all compared to the incision and the scarring that they would get with a regular tummy tuck. So there are many examples. Another one is laser resurfacing. We now have developed a technique where, unlike the traditional approach to laser resurfacing with the carbon dioxide laser, we get a much faster recovery with a lot less redness, and even that redness goes away twice as fast. So all of these innovations are really designed to make the experience as good as possible for the patient. Anesthesia is another one. The fact that we are using local anesthesia, we can get a much safer experience for the patient, a lot less swelling, a lot quicker recovery. Using a laser for blepharoplasty, a carbon dioxide laser that is being used as a surgical instrument instead of a scalpel, that will give us much less bruising and a much quicker recovery. There's a lot of improvements that can be done. Always my approach is to keep in mind, what is it like for the patient? How do we make it more comfortable? How do we get a quicker recovery? How do we do all of that, but also get really good results? So that's my preference.